Welcome back to Choices. On this show, we interview various healthcare practitioners from around southern Vancouver Island and the Gulf Islands, and we let them introduce to you what they bring in the way of choices for your healthcare. Today, I have the privilege of introducing Dr. Matthew Kittleson, a doctor of chiropractic, and what Matthew is bringing into the chiropractic field is a rather unique way of adjusting and working with the body called Nucca. What most of us think of as chiropractic adjustments involves what is called a high velocity, low amplitude thrust, and it often results in that classic popping or cracking sound. What Dr. Kittleson is offering is a unique and different way of approaching the spine. So welcome to the show, Matthew.
Thanks,
Great
Cameron.
to have you on board.
Appreciate it. Thanks very much.
Let's start off first by maybe you explaining to us what led you into this unique approach of chiropractic adjustment.
Right. So in chiropractic school in California, I was studying down in the United States, and one of the things that we know about chiropractic is that there are quite a few different ways to approach the subject. And right from my first bit of time at school, I got introduced through one of my mentors who was also a upper cervical chiropractor. Down in school, he was very adamant about working with people at the level of the neurological level.
Okay.
And so what we found is that when you're working at the neurological level, you have an ability to make the greatest effect at the upper region of the neck because of its proximity and closeness to the brain. That area is just so vitally important that it just really piqued my interest at the level of being able to work with people that are experiencing neurological issues.
Excuse me for a second, when you say neurological issues for the viewers, the opposite would be more of a mechanical approach? Would that be correct in saying that?
Yeah, in a sense, what we have here is we have layers to the body, right?
Sure.
And so what we can find is that people will be addressing issues at the level of the muscle, right? So somebody could have an injury, say if I was a sports athlete and I was a pitcher and I hurt my shoulder, it might be a muscle issue, right?
Okay.
You can also address things and look at the level of the joint system or different areas.
Sure.
As you get a little bit deeper within the body, we get a neurological system, the brain and the spinal cord,
Right.
that is the central nervous system, and it's truly the controlling factor for the human body. And so if you are addressing at that level, you're reaching a depth within the body that allows for certain interventions for certain people that are experiencing issues with this system, right?
Okay. So in a moment we'll come into, I'll ask you to explain who is the best candidate for your type of work.
Right.
But I know I'm curious with your model here. Perhaps you can use the model to explain to us then how you actually do your manipulations.
Sure, absolutely. So what we're dealing with when we're talking about the neck is we're talking about the segments of the spinal column which are known as vertebra. This is a simple and small model of the neck with the head here at the back, and this is the back of the head. If we were looking, we'd be looking at you, Cameron, right now with the face on this region.
Sure.
This would be the spinous processes that you can feel on the back of your neck if you were to reach in behind here. And what we're talking about is we're talking about the delicate relationship between the skull, which is this segment here at the top, and the first and second cervical vertebra, which are very unique in their size, dimensions, and really what they do for the human body. And so when we're talking about this region, we're really interested in the area where a lot of us get our head rotation.
Right.
This is one of the only places in the spine where we no longer have a lot of locking mechanisms with muscle, or with bone, I should say, and we're relying upon soft tissues such as muscles and ligaments to hold this area in place. And so what we're finding is that there can be a large opportunity for misalignment in this region.
Sure.
And so our whole work in the clinic of upper cervical is to really look at and assess this region to see if there are imbalances. Because the structural component of the body, as it holds itself upright in gravity, is really based upon how these vertebrae stack themselves in gravity. If we find that there's levels of rotation and angulation to these joints, then we're going to put ourselves in a compensating pattern where gravity now doesn't really become our friend anymore, and it really forces our bodies to work hard against it.
So you're suggesting then that any misalignment here starts to reflect or ricochet down through the rest of the body?
Absolutely.
Okay.
The way that the body works, whether it's carrying groceries or carrying a baby or holding the position of the head on the neck, we work in a compensation manner against gravity.
Right.
And so it would make sense probably to think that if I was carrying a baby on this hip, if I was a new mother carrying this baby, I would tend to have a twist in that hip to help me hold the weight of that child.
Sure.
Well, the same thing applies if I was carrying a bowling ball here. And what I always joke about in the clinic is that we are carrying a bowling ball, it's just our head.
And some of us definitely have a bowling ball up there.
Exactly. Yeah. And so the weight of the head, which can sit somewhere between 12 to 15 pounds for the average person, can be very much something that needs to be considered if it's sitting off of line. And so if we start to get into a position where there's a head tilt, we'll often find that the shoulders and the rest of the body will compensate to try and level the eyes and level the balance centers of the body.
So then in your field, do you find that once the body starts to compensate, will there be more organic issues coming up, more disease states that result because of that compensation?
Right. And so one of the things that we find is that not only are we dealing with a structural misalignment that puts a lot of pressure upon the muscle systems and really works the body hard throughout its day, but we're also talking about rearranging and changing the dynamic of the spinal column. And one of the things that we know that's interesting about that is that the brain itself actually converts into the spinal cord as it passes down here through the neck.
Sure.
And the information highway that is the neurological system, it needs to be held at a nice tension to be able to communicate well.
Okay.
And so if we start to change the dynamic of the hard structures of the body, that structure will begin to dictate the function of the body.
Okay.
And so often what we'll find is it's as if the communication system, the brain, isn't really communicating that well to the body.
Right. Okay.
And so sometimes our work is more of a fine-tuning of that communication to allow the body then to begin to express itself better.
Let's talk about that fine-tuning then, because I know most people are very familiar with the high velocity, low amplitude thrusting. How do you move these bones in without actually using the HVLA approach?
Right. And so what's really important to understand is that when you do an adjustment with any turning of the head and turning of the neck, that's fine, but what you're attempting to do is you're just bringing that joint into a sense of tension before you make an adjustive thrust.
So the tension being in the soft tissue.
In the soft tissue and the joint capsule itself, the joint itself.
Right.
And so what we do is we adjust in a neutral position. And so what that's like is, it would be like if I was to crack this joint of my finger, what I would end up doing is I would end up taking it to an end range of motion and applying a force.
Right.
Right. What I can do as a Nucca practitioner is that we can make that same adjustment to this joint, but we're going to adjust it without having taken it to a tension position. So we're going to adjust it in that position.
Okay.
And so when we apply that force, we're not going to hear that cavitation, we're not going to hear that cracking sound,
Right.
because we're just not applying the tension to the system. We're still making a hand adjustment and we are still using a force generated by the body. But if you were to stick your hand out like this, Cameron, it's really not much more pressure than about my finger resting on your hand.
And that still causes not a cavitation, but a realignment of the bony structures.
Exactly.
Oh, interesting.
And the really way that we can do this is that we're very, very detailed within our assessment and our analysis. Upper cervical work in Nucca specifically is really built upon the focus of X-ray and looking at the spinal column from 3 different regions. Using these different angles of looking just up here at the top of the neck, we're able to understand exactly what the dynamic of this misalignment is. And so if there's any rotation or tilting of the head, but then we can also completely understand the relationship of your joints, so your particular joints and the angles that they sit. By using all of this information, what we do is we basically just formulate the perfect directional vector to be able to allow all of those things to shift at the same time. And so at this point, we don't actually require a lot of force to do it. It's really just about overcoming the resistance that is in the body and then allowing it to move, right?
So to me, that sounds a bit safer.
Yeah. It can be, right? I personally don't believe that there's any danger with any of the adjustive work that's being done in chiropractic. I think that it's a very safe approach. What I like about this approach personally is it's just the way that I've always felt most comfortable getting adjusted.
Okay.
So I've been adjusted with the high velocity, low amplitude thrust, and it's a very effective way of doing things. What this does, it just brings an opportunity into a place that's a little bit more honoring to the body because we're not forcing it to do anything, but rather we're allowing it to move as it wants to, right?
Now, Matthew, you mentioned x-rays. Before the show started, you were speaking to me about how the x-rays are done in your office.
Sure.
Maybe you can explain what happens in the initial consult, what a person could expect when they first come in.
Sure, absolutely. So when we first do a sit down in the office, we put aside an hour for that sit down. And what we're really attempting to do is just to understand whether or not this is a good fit.
Right.
The reality is that not everybody has an upper cervical issue, and what we want to be absolutely certain about before we shoot x-rays is that it is a situation that we can help with.
Okay.
And so we spend the bulk of that time actually taking our time to talk about things and also run through a few checks to make sure that there are some good indicators of upper cervical need.
Right.
After all of that, that's when we can decide together to shoot x-ray. We do have our x-ray facility in-house. It's a nice digital x-ray. And so it's very good at getting all the information that we need from the x-ray. We can do that right there, and we would be doing that on the first visit.
On the first visit?
Yeah.
Okay. And then once it's been determined that there is a need for this, generally how many treatments, I'm sure you get asked this all the time, how
Right.
many treatments could one expect?
Yeah, absolutely. We're dealing with different case-by-case scenarios, absolutely. And so anytime you're in the healthcare industry, you have to understand that each person is different, but there is a general tendency to the body.
Mm-hmm.
We understand that the body itself has some biological factors to go through in healing processes.
Right.
And so you're aware that you're going to need some time. What we always do in our clinic is we start with the first 2 months of care. And so during those first 2 months of care, because 2 months is a really nice time frame for the body to start and begin a process and show us that it's moving in the right direction.
Would that be once a week then, or?
It can start as much as twice a week for people that require it.
Okay.
But generally speaking, at least at once a week to get started. Yeah.
Okay.
For the most part, the first 2 to 3 weeks are going to be the big deciding factor on getting this moving in the right direction, creating some momentum in the process,
Mm-hmm.
and then we're just supporting it with ongoing check-ins every once in a while.
Okay.
There's no doubt that some people may require a little bit more time than that to heal, and we have seen that in the clinic.
Okay.
And it's really a factor of age, it's really a factor of damage, it's a factor of what we're seeing, everything from on x-ray as well as past histories in
Sure,
the
of
clinic.
course,
Yeah.
of course. Who would be the people that would benefit you from the most that you've seen in your practice?
Right.
Is it whiplash, or is it typical car accidents?
It's a really good question. And what we have been finding so far in the clinic is that it starts with a chronic nature. People who are experiencing upper cervical issues that have not been addressed, and so these misalignment patterns that are just lingering within their bodies,
Mm-hmm.
they're experiencing chronic issues that repeat themselves, right? And so these could be repeated every single day, like a migraine headache. They could be an ongoing process, like somebody who's experiencing low back pain all the time.
Okay.
What we do know is that often when the structure of the upper cervical is misaligned, you're going to have some neurological effect, and so we do find ourselves working with a lot of chronic illness. So a lot of things like fibromyalgias and MS and Parkinson's and these types of issues can be looked at from an upper cervical standpoint.
Okay.
We're very excited to offer that type of an issue, or sorry, of a solution, because
Mm-hmm.
it's not always known that we can work at the neurological level to help with some of these conditions.
Maybe you could explain for the viewers, how is it that when you adjust this area, it affects something way down here at the
Right.
tailbone or the
Yeah,
sacrum?
yeah,
You
yeah.
know, for some people, that connection just doesn't work. So maybe you
Right.
can explain that for us.
Well, we always had an instructor in school that said if you step on the tail's cat, the tail doesn't make any noise. It's the mouth over here, right?
Sure enough, yes.
And so that was always his way of making light of the situation. But it goes back to that compensation motion, right? And so when I sit here and I reach this way and move body weight, right? And so anytime I move body weight, my body tends to move in some sort of compensating manner to be able to hold itself upright.
Right.
And so when we make a correction in the clinic, we actually do a pre-adjustment and after post-adjustment check on the body to make sure that we've made the change that we want. And the way that we do that is we assess it at the level of the hips. And so we're continually and constantly checking the level of hips through leg checks and means that we have in the clinic. And what we're finding is that people that have upper cervical issues are having this compensating pattern move through their body, and eventually the hip level is being imbalanced. And so it's just one of the factors that's easily available and readily available to see within the clinical setting. And so we'll find people that have imbalances within their body, and then post-adjustment, right after the adjustment, right into a place of balance.
Without actually ever working on the hips.
Exactly. So the hips will shift in compensation to bringing this into balance.
There's a connectiveness.
Absolutely.
Through that. So are you working with the dura then, the meninges around the spine?
There's no doubt that all of these soft tissues are being affected, right? One of the things that we don't try and do is we don't try and discriminate between different soft tissues, right?
Okay.
Muscles of the spine are utilized for structure and holding a postural position. Then there's supporting musculature for movement.
Right.
We also have a ton of connections through ligament structures, as well as a lot of soft tissue structures around joint capsules. All of these are being put into play whenever you create any bit of motion.
Okay,
and
sure.
so what we find is that if you get put into a position that's off and your body is constantly in a state of tension battling against gravity, that you're going to find that all of these muscles and ligaments and soft tissues are going to in fact be inflamed. And so people that are dealing with chronic issues, whether they're dealing with chronic neck pain or whether they're dealing with chronic pain such as fibromyalgia that might be more neurological, you have inflammation throughout the body. Yes. On most of these tissues.
Okay.
And so when we create an adjustment and we create a correction to that, we're taking off the major stress, the physical stress of gravity. And so once that physical stress is off of you, it's that sense of relief that the body can say, oh, okay, I can handle this now. And now it can get to work on some of those issues that have been lingering and weren't able to be cleared up.
So have you seen anybody with orthotics no longer need orthotics after that would be, I'm thinking when the hips are realigned, then all of a sudden the feet function better.
For sure. And it's not always the case, but we have seen that particular thing is that there's that sort of a scenario where people have come in and said, you know, I don't feel the need to wear my orthotics anymore because that twist and imbalance that was represent all the way down to the feet has now been leveled off, right? And so people are sitting on a square place. We've also had people sometimes come in and thank us for helping them make good use of their mattresses now. They spent a lot of money on a mattress
and it feels better.
They felt like it was uncomfortable still. But really what they had was they had a twisted and uncomfortable body going on to a great mattress.
Right. So no longer the need for those expensive fancy pillows.
Right. Well, yeah, exactly.
Exactly. Okay.
Find out what the body truly needs, yeah.
Okay. So you came into this with the belief, the passion that this was a more gentle way of working than, say, more historical chiropractic approach. What are some of the inherent concerns with the treatment? Is there anything that you'd have to watch for as a consumer of it? Right.
I think that generally speaking, with the Nucca approach, you're going to find that there isn't a lot of negative side effects.
Okay.
The key to it is just to ensure that the body is ready to go through some of these changes. Right? What we'll find is that the biggest reaction that we'll see in the clinic along a healing path is that the body will be activated and put into a position that's new. And so just like if I were to begin a workout program and went to the gym for the first time, I may experience, and hopefully actually I'll experience some muscle soreness because I've pushed my body to a certain limit, right? When we change the structure of the body, we're likely to see a little bit of that flare up with that as well, potentially, which can always be a good thing.
Thank you. Well, we're running out of time. I'd like to thank you, Matthew, for coming on the show and sharing this with us.
Thanks,
it's always nice to get another approach. I appreciate that. On behalf of myself, Cameron Moffatt, and the crew here at Shaw Cable 4, I'd like to thank everybody for watching the show. In the next few episodes, we're going to be meeting with a Bowen therapist who specializes in concussions, and also a type of physical therapy called tensegrity repair series, which is quite wonderful for pelvic floor and diaphragmatic issues, and we'll be going on site for that. So once again, thank you very much for watching, and stay healthy. Bye for now.